Hello, everyone. As so nicely introduced, my name is Samantha. I'm actually the Chief Clinical Officer at Ubenwa. So today I'll be talking to you about the problem that we are tackling and how we're trying to solve it. So there are two sort of main things if you take nothing else from this presentation. One, babies are dying. It's very sad. Two, we're making an app to try and help. So at Ubenwa, our mission is to leverage artificial intelligence to make clinical-grade infant monitoring technology widely accessible. So what exactly is the problem that we're trying to address? So a fair warning, it's going to get a little bit heavy before we can talk about the solution. So the problem is birth asphyxia. It's when there's an inadequate oxygen supply in a newborn baby, and it can lead to brain injury. So there are a lot of reasons why this can happen. It can either be a problem with the mother during birth, so something went wrong with her. It can be a prolonged or a difficult birthing process. Sometimes the umbilical cord can get wrapped around the neck. Or simply, the newborn is not breathing well after birth. And it's a very important condition because it can cause either sudden death of the infant or long-term disability. And these disabilities can include hearing loss, impaired motor function, speech and learning disabilities, and even epilepsy. So it's a particularly devastating event because, generally speaking, it's a healthy, normal pregnancy, and then all of a sudden something went wrong, and now there's potentially lifelong consequences. So it's devastating not only for the infant, but also the parents who are now sort of mourning this potential future that they saw for their child. It's now been altered, and they've had maybe less than 24 hours to really, adapt to that new situation. So how big is this problem? Why should we care? Well, it's a very big problem. So big, in fact, that about 23% of newborn infants die from this every year. It's one of the top 3 causes of newborn mortality, according to the World Health Organization. So it's a very big problem. If we throw some numbers into that to give it a bit more context, there are 2.5 million newborn deaths per year. That's a very high number. So these are infants who die within the first month of life. And if we take 23% that are due to birth asphyxia, that gives us roughly 575,000 deaths per year due to asphyxia, which comes down to about 1 every minute. So it's a very high rate. And this doesn't even take into account the about 1 million who suffer disabilities from this problem. So it is a very, very big problem. Why is there such a high mortality rate? Well, there's a couple of reasons why. So the first, the treatment actually requires a very rapid diagnosis. And this diagnosis is done by blood tests and neurological examinations. So it requires special equipment, specialized training, and of course, all of this comes at a cost. And the prevalence is not globally uniform. So the highest prevalence is actually in developing countries. There we go. So we'll take a look at the map of the world and look at sort of the deeper colors that are lying in Africa. So these are a lot of the African countries, and they have the highest rates. So this is neonatal mortality for 1,000 live births. And they have definitely the highest rates. And one of our particular areas of interest is in Nigeria, which does have one of the highest rates. And our founder actually learned about this problem as he is from Nigeria. So let's take a context of a developing country, so the Nigerian context. So a lot of births are done outside of a major hospital, which means that they are attended by people who have less expertise, and they have low resources that are available to them. And as I said, early detection is really critical for the treatment. So again, this is very difficult to accomplish in a low resource setting. So it does take equipment and skill. And then unfortunately, once we discover it too late, the baby could have missed out on the treatment and prevented further damage to the brain. So I did tell you that was going to get heavy, so yeah, that was pretty rough, I know. So now we'll get into the fun part. What's the solution? How can we address this problem? Well, first we need to talk about what it is that we need. So we need a better way to identify newborn infants with birth asphyxia in order to reduce infant mortality and disability. But more than that, what we need is something that is fast and accurate. It has to be easy to use and non-invasive, and it has to be cost-effective. So did you know that babies cry? Well, of course you did, right? Everybody knows that. It's sort of a silly question, but they cry for numerous reasons. Maybe they're hungry, so the baby wakes up from a nap, checks the time, and oh boy, it's been 4 hours since I've eaten. I guess I better cry to let everybody know that it's time for my meal. Hurry up.
They could be tired, so maybe it's time for their nap. They could be in pain. Maybe they rolled over in their crib and whacked their arm against the crib and that hurt. Or maybe they have a rough older sibling who was testing the kid and pinched him. Could be anything. It could be discomfort. So sometimes it's time to change the diaper. It's not really pain, but they're not comfortable. Or it could be fussy, aka we have absolutely no idea why you're crying, and despite all our best capabilities to help you and soothe you, nothing works. So yes, we do all know that babies cry, and a baby crying for long periods of time has the ability to break the spirit of even the strongest-willed person that you may know. Okay, so we knew that. But did you also know that the cry can be a vital sign? That's where it gets interesting. So it can be. Crying is actually an involuntary action that is directly coordinated by the central nervous system. So that means we have the brain, sends out signals to the muscles of the head and the neck, stimulates tear production, and coordinates with your breathing to do all of that and make you cry. So we have that, but more interestingly, changes in the normal functioning of an infant's brain actually can be reflected in the patterns of a cry. So if we take a look at what a normal cry signal might look like, we have just a nice little waveform here, and then we have some sort of event, so asphyxia, brain injury, for example. And then we get an alteration in the cry pattern, and that's actually something that we can measure. So in fact, cry is different in babies with asphyxia and brain injury. I've listed a bunch of studies. Nobody needs to know these. It's really just to demonstrate that actually some of these date back to the 60s. So this is not new information. It's just maybe the first time that people are harnessing the power. The main findings are that the cry signal that we're analyzing has an increased frequency, more frequency instability, and there's altered durations and pauses. So there are differences between a normal infant and those who suffered asphyxia. So what did we do? Well, we automated the cry analysis, right? So Ubenwa monitors infant cry sounds using machine learning to detect and notify users of early signs of abnormalities. And we've developed two core tech components. So the first is a cry detection algorithm, which simply identifies when a baby is crying amongst all other talking and all other noise. And this is fairly strong, about 96% accuracy. And then there's the asphyxia detection algorithm, which detects the brain injury due to asphyxia, which currently has about an 88% accuracy. So very strong results, but as anybody in medical device development knows, the work is never done, always more work. So we do have additional acquisition and validation studies that are just getting off to a good start now. So we have two study sites. One is from Canada, yay, with the Montreal Children's Hospital, a part of the McGill University Health Centre, where I do my research. And then we have the Enugu State University Teaching Hospital, or ESUF, which is in Nigeria. And the objective with this is really to collect up to 10,000 clinically annotated infant cries to help us train our algorithm. So this is a nice photo of our team in Nigeria, our principal investigator with a few of his residents and our Ubenwa team. And here is our founder, Charles, taking a recording from a baby using the application. So in this study, what we're doing is we're doing these recordings, and we're also doing the blood tests and the neurological examinations that I had mentioned in the beginning, so that we can correlate at the time of measurement the cry signals with the brain injury status of the baby. We'll also be doing a follow-up at 18 months in order to move past maybe a diagnosis, and also look at sort of a prognosis, so see if we can predict how the babies will be doing later on using the cry that we have right now. Okay. So there are two main sort of applications of our technology. The first is through the app, so you could actively screen an infant using the app. And the second is for more passive screening, so integrated into baby monitors and smart devices. So this would passively listen to see if one is a baby crying and two is the result abnormal. So if you wanted to screen your baby using the app, you would click on Diagnose, which would obtain a recording for about 5 seconds. It's very rapid. Then you could choose to analyze that recording and provide a risk diagnosis. So this would give you a positive or a negative outcome, depending on the percent risk that we would get.
But there are two other features that we're also going to integrate. First is the advice feature. So this will indicate whether or not the user has to go to an appropriate hospital, depending on the results. And to provide tips on what to look for in the meanwhile, things to watch out, like their breathing and their temperature, and to keep the baby cool. We also will have a location feature. So this will locate the nearest appropriate hospital for them to go to, and will also guide them how to get there depending on where they are. So the different transportation options that they might be able to use. So does this solution address the need? Well, I believe it does, but I'm of course biased. So it detects swiftly, so it's very rapid. It's a matter of seconds before we get our diagnosis. It's non-invasive, but more than that, it's contact-free. So nothing has to touch the infant. There are no sensors that go on the baby. There's no specific exam. No one has to touch. Everybody can just be 10 to 15 centimeters away from the baby and take their recording. So that's very interesting. It's of course cost-effective. So when you think about the cost of doing a blood test or having personalized care, the specialties, all the different facets of medicine that go around this diagnosis, it's very cost-effective compared to that. And it requires no clinical expertise, so there's no specialized doctors to run this neurological exam or trained personnel that need to take and run the blood tests. So yes, Ubenwa addresses this need, and more importantly, it actually meets all the criteria that we discussed earlier, which are very important in a developing world. So that's all very great, but what's next? Like I said, work never done. Well, we plan to expand into other clinical applications using the CRY, and to investigate other contact-free measures of health. So there's a lot of work being done in this space that we feel could be very useful. Ultimately, to continue our mission to make clinical-grade infant monitoring technology accessible to all. Oh, the slide was copied twice. So that's it for me. Thank you very much for listening. I know it was a little bit rough in the beginning there, but we got through. Thank you.